Dear learners, welcome to NIOS Studio. My name is Arvind Narayanan. I come from Pratyusha Foundation, an organization which is working for the cause of elderly. Today, we'll be discussing about the growing importance of elderly or geriatric caregivers. Now, these are the topics which we'll be covering today. Caregiving basics, that is, what is caregiving, what is elderly caregiving as such, and what does a caregiver mean? We'll be covering this. Discussing about how aging is happening worldwide. Elder care needs surge. We'll be discussing about how elder care is surging across the globe. Policy response. We'll be discussing on what is the kind of policy response which governments of different nations, especially India, multilateral and bilateral agencies are giving towards aging. We'll come towards Indian aging scenario. हम इसमें ये बात करेंगे कि भारत में अभी एजिंग का या वृद्धावस्था की तरफ बढ़ते हुए क्या सिनेरियो है, किस तरीके से चीज़ें चल रही हैं. Caregivers challenge. We'll be discussing about what are all the challenges a caregiver has to face while becoming a caregiver, while delivering his or her services. And technology and community solutions. इसमें हम बात करेंगे कि आज की आधुनिक जो टेक्नोलॉजी है और कम्युनिटी बेस्ड सॉल्यूशंस किस तरीके से एल्डरली केयर में हमारी सहायता कर रही हैं. सबसे पहले, who are elderly caregivers or who is an elderly caregiver? A person who provides direct care for elderly people who are aging and who require support or are chronically ill are called elderly caregivers. संक्षिप्त में, कोई भी ऐसा व्यक्ति, आदमी हो या औरत हो, जो एक वृद्ध अवस्था के में आए हुए लोगों की सहायता करता है, उनको सपोर्ट देता है, या फिर ऐसे लोग जो क्रॉनिकली इल हों वृद्धावस्था में, उनको सपोर्ट करता है, उसको हम एल्डरली केयरगिवर या जीरियाट्रिक केयरगिवर कहेंगे. What are the qualities or traits of a geriatric caregiver? Show empathy. सबसे पहले, the caregiver has to show empathy. Empathy का मतलब है कि आप अपने आप को दूसरों के स्थिति में कैसे डालते हैं, उस स्थिति को कैसे समझते हैं और अपने आप को उस स्थिति में डाल के उसका सोल्यूशन कैसे निकालते हैं, उसको एम्पैथी कहते हैं या सहानुभूति. इज एबल टू टेक अप रिस्पॉन्सिबिलिटी एंड इज पैशनेट. वो रिस्पॉन्सिबिलिटी, दायित्व उठाते हैं और काफ़ी पैशनेट हैं. जिस काम के लिए वो कर रहे हैं उसके लिए वो काफ़ी पैशनेट हैं. दे हैव पेशेंस. उनमें काफ़ी पेशेंस होता है. वो चीज़ों को झटके से नहीं करते हैं. दे डू इट वेरी स्लोली. दे अंडरस्टैंड व्हाट दे हैव टू डू एंड देन दे डू इट. दे हैव अ स्माइलिंग फेस एंड दे आर वेरी सपोर्टिव एंड एनकरेजिंग. इसका मतलब है कि जब भी कोई केयरगिवर किसी भी क्लाइंट या किसी भी एल्डरली पर्सन के पास आता है, तो उनके चेहरे पे एक हंसी होनी चाहिए, या चेहरा जो है वो खिलखिला ऐसा होना चाहिए, दुखी चेहरा नहीं होना चाहिए. वो काफ़ी सपोर्टिव होते हैं और एनकरेजिंग होते हैं. पंक्चुअलिटी. कोई भी केयरगिवर किसी भी एल्डरली के साथ जब काम कर रहा है तो उसको टाइम पे काम करने की बहुत ज़रूरत है. फॉर एग्जाम्पल, अगर वो टाइम पे उनके घर पहुंचते नहीं हैं या टाइम पे उनको नहलाते नहीं हैं, तो इससे जो वृद्ध लोग हैं उनके मानसिक स्थिति पे भी काफ़ी फर्क पड़ सकता है, क्योंकि दे आर यूज्ड टू अ सर्टेन टाइम पीरियड. They are good listeners and good communicators. At the same time, they are able to maintain confidentiality. वो सुनते हैं लोगों की और अच्छी तरीके से अपनी जो फीलिंग्स हैं उसको कम्युनिकेट कर पाते हैं, बट वो ऐसी चीज़ें नहीं बोलते हैं जिसको बोलना नहीं चाहिए. फॉर एग्जाम्पल, अगर इफ देर इज सम प्राइवेट थिंग विच द एल्डरली पर्सन हैज टोल्ड द केयर गिवर एंड it is not meant to be shared with the public at large. So good caregiver will never share it with the public at large, but keep it to themselves, but listen it very carefully from the elderly person. They have multitasking capabilities. What is multitasking? When a person is able to do one or more thing at the same time or process one or more things at the same time. It's called multitasking. Now, why does a caregiver need to have multitasking capability? Is that the caregiver is always prone to different decisions at different points in time. For example, if a caregiver is taking care of a person, and then he also has to, at the back of his mind, understand that there is what next is supposed to come, and if there is anything else to be done with that. So while taking care of that person, उस वृद्ध जने की देखभाल करते करते उनको ये भी देखना पड़ता है कि अगला कार्य वो क्या करें उनके लिए, या फिर इसके साथ कुछ और उनको करना है कि नहीं. So that's called multitasking. So an elderly caregiver has to have multitasking capabilities. He or she thinks quickly and is very attentive. ये लोग बहुत जल्दी सोचते हैं, प्रोएक्टिव होते हैं और काफ़ी अटेंटिव रहते हैं. मतलब उनके आंख कान खुले रहते हैं. कोई भी अगर मान लीजिए कुछ होता है तो ये लोग हमेशा तत्पर तैयार रहते हैं हेल्प करने के लिए या कुछ, क्योंकि एल्डरली पर्सन के जो दिनचर्या में कभी भी कुछ भी हो सकता है, बिकॉज दे नीड सपोर्ट. सो ये जो सपोर्ट है, ये सपोर्ट देने के लिए द केयर गिवर हैज़ टू बी वेरी वेरी अटेंटिव एंड ही हैज़ टू बी क्विक विटेड. विलिंगनेस टू लर्न. ऐसा नहीं है कि कोई केयर गिवर है और उसको सब कुछ आता है. रोज़ नई नई चीज़ें वो लोग सीखते हैं, और जो सीखते हैं उसी को वो लोग अपने दिनचर्या में ढालकर अच्छी तरीके से जो एल्डरली पर्सन है उसको सेवाएं देते हैं. विलिंग टू गो एक्स्ट्रा माइल एंड बी फ्लेक्सिबल. केयर गिवर्स कभी ये नहीं बोलते कि ये मेरा काम नहीं है या मैं ये नहीं कर सकता या कर सकती. They have to go that extra mile and be flexible in the service they are providing to the elderly person. What are caregivers' responsibility? Caregiver की responsibility क्या होती है? अभी हमने ये देखा कि caregiver कौन होता है और qualities of a good caregiver क्या क्या हैं. अभी हम ये बात करेंगे कि एक caregiver जो होता है उसकी responsibilities क्या क्या होती हैं. Emotional and social support. सबसे पहला responsibility of a caregiver is that they have to provide emotional and social support. Providing companionship. कोई भी वृद्ध आदमी या औरत जब एक caregiver की सेवाएं लेते हैं या फिर फैमिली में जब कोई caregiver बनता है तो उनको companionship की काफ़ी ज़रूरत पड़ती है. जब भी कोई elderly घर पे होता है तो सबसे पहला उसको ज़रूरत पड़ती है कि कोई उसके साथ बात करे. Somebody needs to talk to them. So providing companionship is one of the most important responsibilities of a caregiver. Discuss ongoing life challenges with the care recipient. उनकी जो केयर रिसीव कर रहे हैं वृद्ध लोग जो हैं, जो केयर रिसीव कर रहे हैं, उनकी लाइफ में क्या चल रहा है या उनकी लाइफ के क्या चैलेंजेस हैं, इसको भी उनको डिस्कस करना, इमोशनल सपोर्ट देना बहुत बहुत ज़रूरी है. इसीलिए पहले हमने देखा था कि दे हैव टू बी ए गुड लिसनर. उनको काफ़ी अच्छी तरीके से चीज़ें सुनने का और पेशेंटली सुनने का अनुभव होना चाहिए. सो कोई भी एल्डरली जब अपने लाइफ के ऑनगोइंग चैलेंजेस को डिस्कस करता है केयर गिवर के साथ, सो दे शुड बी एबल टू लिसन टू इट विद पेशेंस. फैसिलिटेट एंड पार्टिसिपेट इन लेजरली एक्टिविटीज़. एक केयर गिवर के दिनचर्या में जब केयर गिवर अपना दिनचर्या बनाता है केयर रिसीवर के साथ या फिर जिसको केयर देने वाले होते हैं, तो उस टाइम पे फिजिकल एक्सरसाइज अपने दिनचर्या में पक्का डालते हैं. सो ये किस लिए डालते हैं? ये इसलिए डालते हैं क्योंकि एक्सरसाइज और हैंड लेग मूवमेंट, इसका बॉडी मूवमेंट का बहुत ज़्यादा महत्व है एल्डरली की लाइफ में. सो ये केयर गिवर्स जो होते हैं ये चीज़ों को फैसिलिटेट कराते हैं, और एल्डरली जो होते हैं उनके दे फैसिलिटेट लेजरली एक्टिविटीज़ लाइक प्लेइंग गेम्स. उनके साथ चेस खेल लिया, कैरम बोर्ड खेल लिया, या फिर उनके साथ बैठ के ताश खेल लिया. सो दे फैसिलिटेट दैट. सो दिस ऑल्सो इक्वल्स टू इमोशन, प्रोवाइडिंग इमोशनल एंड सोशल सपोर्ट टू द एल्डरली. हेल्प केयर रेसिपिएंट मैनेज इमोशनल रिस्पॉन्सेस. केयर रेसिपिएंट जो होता है जब वो कभी भी इमोशनल हो जाता है, फॉर एग्जांपल जब बोलते हैं कि जितने आप एज में बढ़ते रहते हैं उतने ही आप बच्चे हो जाते हैं. सो जब एक एल्डरली अपने इमोशंस को काबू नहीं कर पाते, तो केयर गिवर का ये काम होता है टू हेल्प देम मैनेज देयर इमोशनल रिस्पॉन्सेस। जब भी उनको लगता है कि कभी खाना नहीं खा रहे या फिर रूठ के बैठ गए हैं, तो केयर गिवर का ये काम होता है कि उनके साथ बात करें। दे हैव टू टॉक टू देम, दे हैव टू मैनेज देयर रिस्पॉन्सेस सो दैट they make a conducive environment for the care receiver and get them back to their daily schedule. One of the most important things is also troubleshooting problems. Caregiver has to have the troubleshooting abilities so that day to day when they are with anyone, family caregivers troubleshoot things daily. For example, if the elderly have left their keys somewhere, they have to understand where they might have left it. They have to trace it back to where they have left it and then get the keys. So things like this happen daily in the life of caregiver, and they have to have troubleshooting capabilities. Part of their responsibilities is also the main domain, which is that the caregivers has to take care of themselves. One cannot give care unless and until they take care of themselves. Be it a female or male, they first need to take care of themselves both physically and emotionally. A caregiver can't have a negative emotion and then start giving care to the elderly. They have to have positive emotions in themselves so that they transmit and radiate the same when they are giving the care. कोई भी caregiver अपने आप को इतना they should never feel negative about themselves, because whatever they are feeling at that point in time is what is being emulated to the care receiver. So self-care as a part of caregiver's responsibility is very important. Supervision and mobility. एक caregiver एक care receiver को हमेशा उनकी निगरानी में ही रखता है, कभी भी उनको आंखों से ओझल नहीं होने देता, क्योंकि उनका काम ही यही है कि उनको सुपरवाइज करें और उनकी मदद करें उनको चलने फिरने में, उनके डेली लाइफ में. सो सुपरविजन एंड मोबिलिटी फॉर्म पार्ट ऑफ द केयर गिवर्स टास्क. उनको नहलाना, उनको धुलवाना, उनको ड्रेस पहनाना, उनको खाना खिलाना, feeding them, dressing them, all these are basic tasks which the caregiver has to perform with the elderly. Management of behavioral symptoms. Like we spoke previously, they have to manage their emotional responses. That's part of their job. They have to also, look after the elimination needs of the elderly. For example, taking them to the washroom. If there is incontinence, how to, tackle that. And dealing with incontinence is also part of their job role. Patient transferring or transferring the elderly from bed to wheelchair and wheelchair to bed. Moving the wheelchair and locking it, all this is also part of the caregiver's responsibility. Help them getting inside and outside. If there is mobility issues with the care receiver, help them in getting inside and outside a car, maybe inside a room or a bed, anything. Health and medical care. They have to encourage a healthy lifestyle with the care receiver. They have to give a schedule which has exercise, yoga, or maybe massage as a part of their schedule, and they have to see that the care receiver is getting the same. Encourage self-care. So they have to also encourage their own self-care as a part of their ongoing routine. Encourage treatment adherence. If the care receiver is getting some treatment, they have to encourage them to probably take the medicines on time, probably go for physiotherapy on time, because this also forms part of their responsibility. Manage and give medication, pills or injections. We discussed about this. If the patient is diabetic, if the care receiver is diabetic, they have to ensure that insulin, if they are taking insulin, it has to be given on time. The caregiver should also know how to operate a medical instrument or a medical equipment. For example, a nebulizer. They have to know how to operate a nebulizer. For example, oxygen cylinder. They have to have the knowledge on how to operate the oxygen cylinder if need be. The caregiver also has to have basic knowledge of how to prepare food or special diet for the care receiver. This does not mean that they should have a plan of elaborate menu, but basic dal or basic tea and basic porridge or stuff like that, they should be able to prepare. Respond to acute needs and emergencies. If there is an emergency arising, the caregiver should be able to respond to that particular emergency properly. Provide wound care. If there are any cuts, any wounds in the care receiver's body, they should be able to provide the basic first aid required. So part of caregiver's responsibility is also to seek information and take this information and collate it, so that if there is a need to tell this to the doctor or any healthcare professional, they should be able to do it. They should be able to facilitate person and family understanding. They would have to communicate with a doctor, nurse, or any other health worker on what is the kind of support being provided and what is the kind of support being received by the care receiver. They have to facilitate, the provider's understanding. They have to locate, arrange, and supervise the care receiver. They have to make appointments for the care receiver, order prescriptions, medicines if required. So we spoke about who a caregiver is, what are the qualities of a caregiver, what are his or her responsibilities. Now, why is caregiving a very, very important phenomenon which has happened? Let's look at the slide. 1 out of every 6 people aged 60 plus, they will be aged 60 plus by 2030, which means that 2.1 billion 60 plus people will be there by 2050. And 80% of seniors are in the lower or middle income countries. There is a huge strain on healthcare and social security system because of this. See, on the one hand, we see that the population is increasing. On the other hand, we also see that the health facilities have also increased, which has contributed in longevity of people. Now, this particular longevity has also struck a chord with the elderly people. Health has improved manifold, but at the same time, there are other conditions which aging people have. What are the global trends which we can see where elder care needs surge? So aging populations due to long life expectancy and lower birth rates can be seen. Birth rates are low. China is a very good example. Birth rates are low there and aging population has increased. We have countries like Japan in which there is maximum number of population is aged and the younger population is not there to take care of them. Rising demand for healthcare, assisted living, and long-term care services. The Western world is already facing this particular problem. Shortage of trained caregivers and increased healthcare cost. So, a lot of people are not trained for providing care, and the healthcare cost has also increased. So, if you see there is an imbalance between the care, trained caregivers and also the healthcare costs. Greater use of technology, which is telemedicine and health devices to support aging. Need for age-friendly infrastructure and social support system. So the global policy response towards this, what has the global policy responded towards this? The United Nations or the other people who are responsible for global policies, how have they responded to this? The United Nations, the MIPAA 2022 is a global framework of guiding national and international policy on aging. They have focused on 3 different priority areas: older persons and development, advancing health and well-being into old age, ensuring enabling and supportive environment. And they have also called for integrating older persons into economic and social development. So the global policy towards aging by United Nations Myriad International Plan of Action was this: Universal Declaration of Human Rights, which was signed in 1948, and UN Principles for Older Persons, which was done in 1991, says promote dignity, independence, participation, care, fulfillment, and access to services for older persons. Encourage countries to protect elderly rights and prevent discrimination. So, this is what the Universal Declaration of Human Rights says. Sustainable Development Goals, the SDGs, which was signed in 2015 to 2030, mentions, while not elderly specific, but the SDG emphasizes on leaving no one behind and address health, poverty reduction, gender equality, and social inclusion, which are all relevant to aging populations. The WHO Global Strategy and Action Plan on Aging and Health from 2016 to 2020 focuses on healthy aging, strengthening healthcare systems, creating age-friendly environments, and improving long-term care. They also support the decade of healthy aging, which they have declared from 2021 to 2030. The decade of healthy aging, again from 2021 to 2030, says the UN and the WHO led efforts to improve the lives of older people globally. Their focus areas are combating ageism, integrated care, long-term care system, and creating supportive communities. The ILO Convention, the International Labour Organization Convention, says promoting income security for older workers, access to social protection, and age-friendly labor policy markets. So this is what the ILO has mentioned. Regional policies in different countries like Europe, Africa, and Asia Pacific mentions that the European Union mentions active aging policies, pension reforms, and health programs. This is what they have included in their countries' policies towards aging. The African Union has policy framework and plan of action on aging to improve older persons' rights and services. In the Asia Pacific, we have regional action plan aligning to the MIPAA, which we discussed, which is the United Nations Madrid International Plan of Action on Aging. So these are certain international level policies which have been signed towards aging or towards helping the aging population. How is India being affected by all this which is happening throughout the world? India's demographic shift, if you see, is that India's population is aging. We will discuss about this more after a short break.
प्रकाशित करने राहों को आलोकित करने हम अपना दीपक स्वयं बने, हम अपना रास्ता स्वयं चुने। हम अपना दीपक स्वयं बने, हम अपना रास्ता स्वयं चुने। जीवन ये प्रकाशित करने राहों को आलोकित करने।
धन साधन समय की सीमा से विद्यालय जो मुक्त हो, धन साधन समय की सीमा से
कभी पढ़े हम कहीं पढ़े वे विषय की लोच से युक्त हो।
कभी पढ़े हम कहीं पढ़े वे विषय की लोच से युक्त हो।
मित्रों हम उठे और जागे,
मंजिल आने की ध्वनि सुने हम, अपना दीपक स्वयं बने हम, अपना रास्ता स्वयं चुने।
जीवन ये प्रकाशित करने, राहों को आलोकित करने।
राष्ट्रीय मुक्त विद्यालय का है द्वार खुला सबकी खातिर।
शिक्षा परीक्षा का अवसर एक बार ही क्यों मिलता फिर।
शिक्षा और परीक्षा का अवसर एक बार ही क्यों मिलता फिर। दुनिया में इसके केंद्र बहुत,
कोई मन चाहा केंद्र चुने हम, अपना दीपक स्वयं बने हम, अपना रास्ता स्वयं चुने। कोई मन चाहा केंद्र चुने हम, स्वयं बने हम,
Welcome back, learners. We spoke about who a caregiver is, what are the qualities of a caregiver, what are the responsibilities of a caregiver. We spoke about global situation, about elderly populations increase. We are now coming to the Indian context, and I will now talk about the growing importance of caregivers in India. India is also rapidly aging. Recently, the UN data report said about 137.9 million Indians aged 60 plus in 2022. This will be rising to 158.7 million by 2025, which is approximately 11% of the total population. The share is projected to double by 2050. About 1 in every 5 Indian will be a senior. By mid 2040, older adults may outnumber children under 15. The oldest old, which is 80 plus, will swell fast, growing to 279% between 2022 and 2050. Many Indian elders live on little over 40%, are in the poorest wealth quintile, and nearly 19% have no personal income. These figures highlight a looming surge in care needs under challenging socio-economic conditions. Seniors 11% now, growing to 20% by 2050. Well, India's 60 plus population has grown very quickly. 41% decadal growth has happened, and this is set to accelerate even more. Current estimates around 158 million by 2025 mean seniors are 11% of the Indians. The United Nations projections indicate this will be roughly doubled to 20% by 2050. There is a rapid rise of the very old. 80 plus population is again increasing a lot. Economic vulnerability. Many Indian seniors lack financial security. About 40% are in the lowest income quintile, and nearly 1/5 have no independent income. Family structures are also changing. We can see mostly there are nuclear families now. People are moving away from their homes in search of employment and other things to different cities or even different countries. This leaves the elderly back home. Who is there to take care of them? Lack of formal care infrastructure. We have still not formalized the care infrastructure here. Many old age homes are coming up, definitely, but as such, with the increase in population, it is not able to cater to everyone. Recently, in Kerala, the old age homes have been so much full that they are telling the new entrants to stop. They're not taking any more new entrants. Economic and social and emotional burden on the families is happening. Role of technology in caregiving has also increased. With the advent of increase in elders, role of technology has also taken greater shape. Rise of caregiving as a profession is being seen. We can see many informal setups of caregiving have opened, and caregivers are being trained both formally and informally, but this is not enough to take care of the increase in the elder population. Awareness of elderly rights and dignity is also happening. We look at different programs which are which our Indian government has now taken out for the elderly people. The first one being the NPHCE, which is the National Program for Healthcare of Elderly. This was launched by the Ministry of Health and Family Welfare. This provides specialized healthcare services for elderly at primary, secondary, and tertiary levels. This also includes setting up geriatric wards in hospitals, rehabilitation centers, and training healthcare workers. The integrated program for older persons, again run by the Ministry of Social Justice and Empowerment, provides financial assistance to NGOs for running old age homes, daycare centers, and mobile Medicare units. Senior Citizens Health Insurance Scheme. The Varisht Mediclaim policy offers health coverage for senior citizens. Our own Ayushman Bharat also includes provisions to cover elderly healthcare under certain categories. The Maintenance and Welfare of Parents and Senior Citizens Act 2007. This is a legal framework that mandates children or relatives to provide care to elderly parents, includes provision for setting up old age homes and also protecting senior citizens' rights. Old age homes and daycare center. Government supported and private run facilities offering residential, medical, and recreational services for elderly are being set up. Helpline and support services. Senior Citizens Helpline for reporting abuse, seeking medical help, or getting legal advice have been set up. NGOs in India run awareness program, mobile health units, and support services for this. Promotion of geriatric education and training. Specialized geriatric departments and courses in medical colleges to train doctors, nurses, and healthcare workers have been set up. Technology solutions, encouragement of telemedicine, health applications, wearable devices, monitoring devices, and assistive technologies to improve healthcare of the elderly is being instituted. We can also look at some of the examples which different states in India have come up with. For example, Kerala has got the pioneering Kudumbashri model, which is in fact one of the best in the country, wherein it supports elderly and its initiatives. Tamil Nadu has come up with structured old age home and daycare centers supported by the state. Maharashtra, the urban focused elder support system is happening there in collaboration with NGOs for dementia care. Rajasthan, rural focused healthcare checkup camps and mobile medical units for seniors is being set up. In Delhi, helpline and elder friendly policing, including senior citizens welfare scheme, is being emphasized here. Emphasis on both urban and rural challenges, showing diverse caregiving models across regions have been seen. This is some of the state initiatives which India is being run. This is apart from what the central government or the national initiative which we talked about previously is being done for elderly care. Technology and community solutions. New technologies are coming in which are helping our elderly to manage their lives better. We spoke about wearable devices, we spoke about monitors which give signals and which give data to healthcare providers to monitor elderly health. Telemedicine platform is one such platform which has been used increasingly across regions for remote diagnosis and doctor consultations. E-health applications for medication, reminder and health tracking is being used mostly in urban areas. Smart home devices, emergency alert buttons, motion sensors, fault detectors are some of the new technologies which have come to support elder care in India. Assistive devices like hearing aid, walking supports, customized wheelchair or electronic wheelchair are also there, which makes the elder's life more easier. Community health workers and mobile health vans in rural areas, especially focusing on elderly, have been commissioned. Volunteer buddy system and elder support groups, as we spoke about in Kerala's Kudumbashri model, have also been set up in some states. Digital health initiative under the India's National Digital Health Mission focusing on elder care has also been set up. New startups focusing on elder care solutions with and without technology, both are starting. These startups work in the area of service delivery, for example, training, setting up old age homes, running of old age homes, setting up specialist dementia care centers, and other allied training courses is being done. Let's speak about some of the challenges which the caregiver faces while delivering care. The caregiver undergoes a lot of physical and emotional burnout from constant care. He or she needs to take care of themselves while providing care. We spoke about self-care as one of the duties of caregivers. This is because the care which the caregiver provides also demands a lot of emotional and physical push from him. So they undergo a lot of physical and emotional burnout while providing care. There is a lot of financial strain which the caregivers undergo. For example, for family caregivers, they have to probably leave their jobs and take care of their elderly if they are home. There is loss of income for some. Some sacrifice their own careers. Women staying at home, taking care of probably their own elder parents or the parents of their husbands, undergo some of these challenges. Lack of formal training or certification for family caregivers is also one of the challenge. Family caregivers are not trained on how to provide care or the basics of caregiving. As a matter of fact, what happens is they have the ability to do things but not in a very scientific manner. Slips, falls by elderly and not treating them properly or not lifting them properly can lead to long-term damage. This can be cured or this can be stopped if the caregiver undergoes proper training on how to manage elder. Social isolation and lack of mental health support. So the caregiver also undergoes social isolation because most of the time he or she is taking care of the elderly. They don't have people to talk to, people to share their feelings with. As a matter of fact, it reflects on their mental health a lot. There is limited respite care options or backup systems available for caregivers. For family caregivers, this is very, very important because they are the only ones who are giving care to the elderly at their homes. In case of paid caregivers or professional caregivers, the family pays a professional who comes for a specific period of time, takes care of the elderly and goes away. But as we spoke about, there is very limited respite for people who are inside the family giving care to the elderly. Cultural expectations are placing heavy burden on women, especially daughter-in-laws. We spoke about this. Women of the family, especially either the daughter or the daughter-in-law, it is mostly mandated in the family that they should be taking care of the home, and extension of the home comes the elderly people who are in the home. This takes a lot of toll on their physical, mental and emotional health. This is due to the cultural expectations which are prevalent in certain states in India, especially in the rural parts of India. Professional caregivers also face low wages, poor working conditions, and limited career pathway. This happens in not a professional setup, but a stopgap setup wherein things are happening on the go. The caregivers are not associated with any company or any institution. They are associated with individuals who try to take advantage of them. What is a trained caregiver now? So different types of trainings are available for caregivers. Certain trainings are given to family caregivers and certain trainings are given to professional caregivers to make them as professional caregivers so that they can earn their living. Skilling initiatives have been instituted by the Government of India through Ministry of Social Justice and Empowerment, Ministry of Health, the National Skill Development Corporation, NIOS, and other agencies to give a structured training for the caregivers as per the Indian scenario. These trainings range from 1 month to 1 year, making the participant fully aware of the challenges in caregiving, how to give care, what are all the impediments, how they can overcome it, right from physical, social to psychological support. The longer the course, the better training they receive. Caregivers can also look forward for international appointment due to huge demand. So employment opportunities are also available outside the country for caregivers once they are trained and certified. Language and cultural training is a must to move outside as a caregiver. There is a huge demand in the Western countries because there itself mostly nobody enters this profession of caregiving due to the high demand it takes a toll on the caregiver as such. The caregiving profession is a noble and a dignified profession which is carving its own niche in all countries of the world. Notably, in India, we are at a very, very excellent point in time wherein we have the demographic dividend of more younger people right now who can be trained, who can be made aware of caregiving as a profession. People can look at it as a long-term professional goal, not only for their own families, but also take it up as a profession and move out of the country, or maybe even start up care homes for elderly. The caregiving scenario in India is fast changing. As we discussed the statistics, large number of elderly population is expected in the coming years. The need for these trained and certified caregivers is a must, and it should be taken up by one and all. We are all part of the caregivers community, as we have taken care or will be taking care of somebody in our family who is an elderly. With this, I end this small topic. Thank you very much. Thank you.